rotate rotating head, turn the rotating head. When the power is on, it's recommended not to turn it.
Okay.
Because then it'll be set and the gears are kind of active. But like since we're a little bit tight about if it stops like this, it's kind of a hassle if somebody uses this,
Okay.
at least temporarily, so that you know that it is safe to turn it. Excuse me. Power off. Power on button is back here. There's a back switch here.
If we do.
You'll guys will find it. Power on and off. This one here, since you're photoing, this is just for an emergency stop.
Okay.
If something happens, I have never seen anything happen, but by FDA and regulations, if something happens, press it down and the power shuts down, everything shuts down. If that happens ever, you turn it clockwise or toward the arrows, it pops back up and then it's ready to repower. That's just so you know. So that's not the on and off switch. The on and off switch is here. It's recommended at the end of the day, always power it down.
Okay.
Computer can stay on, whatever you normally do with your office computers, it's okay, but this one the manufacturer recommends that at the end of the day,
Shut it
on the
down.
weekends when it's not being used, turn it on.
Okay.
Alrighty, so I'm turning it on. It always, as you can hear, this is standard initialization of the system, and it'll do this every time. Basically, it's resetting. It's got a lot of meters and readers that detect the different positions for the chin rest and the rotating head. As it's doing that, it's okay. So the only other, there is no real other settings on the machine that need to be done. When you turn the power on, and then you have the up and down switch, and if you press it, obviously then you adjust it appropriate height for the patient. As far as maintenance, there really isn't any maintenance that you guys are required to perform. As far as sterilization or disinfecting, obviously you don't want to use any kind of sprays, a lot of little gaps and cracks and whatnot, so you don't want to spray anything to get any fluids within inside the compartments. But with you guys have some antibacterial wipes or something, follow your standard regular hygiene or disinfecting or practices that you're gonna do, and mainly the patient is here and they hold on to here, and so where the body parts, nobody touches these. There's no germs, but I see a lot of them, they wipe down these parts here in between. But again, doesn't affect the functionality of the machine. It's totally your guys' yeah. I mean, in the office. This is, by the way, this is missing two things. These are supposed to have temple holders. Little plastic rods about yay long. They attach to here. There's a little knob here that you can turn that would normally open and close them. For some reason, they lost them in the packaging.
But we can order them.
We will get you as
Okay.
soon as I get back to the office.
Okay.
Definitely. So, but that's one thing that's missing here. But they're not meant to hold the patient so that they cannot move. They're just sitting there to kind of steady so that there's no incidental wobble to just regulate. So that's missing. And the other thing is missing, this is just my test chin block. There's 4 different types that you can put here. For if you're taking sinus, there's one, TMJ, there's another one, and then there's one, this would be panoramic, and then there's one that is suggested for cone beam or 3D. I don't know, do you guys familiar if I say 3D, that's the same as cone beam, which is same as CTCB? They're all the same thing.
Yeah.
But so cone beam is the same as 3D, which is the other functionality. It's panoramic and it's cone beam,
Right.
or 3D. That's the capabilities of
But
it.
we can order those pieces too.
I will get you the pieces.
Okay.
You can order more, of course, but I will get you the pieces that are missing.
Good.
Just free of charge. We'll just get them sent to you guys since they're missing. I don't know what happened to them between transport from Washington to here.
Okay.
Cleaning, up and down, rotating. Any questions? It's pretty straightforward. I'll talk about patient positioning, and I will. There is a manual, but this is kind of just your general user's guide
Okay.
for it. Section 4 of panoramic procedures, and there's a picture of the chin rest with the bite block, which is missing. Oh, that's the third component.
Okay.
There's no
Let me
bite
write
block
this
on
down.
it. Bite block, chin rest, temple supports.
Okay.
And those be transferred into my case notes as
Okay.
well. This is good for your overall understanding of patient positioning, but I've got an electronic copy that I'll send you guys as well,
Good.
which is more focused in on just the positioning and not so much general. But so because of time limitations, I'm going to go kind of very